How you doing?
Not too shabby.
Good. Hi, my name is Diana Foster and I'm a registered nurse and I'm going to be conducting a physical assessment on Heidi. We're going to do a head-to-toe assessment, and this is assuming that our patient is normal and healthy, but we're going to go over all the points of an assessment that you would need to do. First of all, of course, I would assess her as she's coming into the room, assess her gait, her walk, her stance, just being observant all throughout the assessment in different areas. I'm going to begin with, of course, we took her weight and her height before she came in, and a patient history on you, which is in your chart, and I will review that at the end of our assessment. I would begin with her skin and tegumentary system, inspecting just all of her body, her overall appearance of her skin, the general turgor, color, her venous patterns on her skin, whether there's any lesions or problems that she might be having, patches of dryness, and so forth. We would, if there were any wounds, we would assess for healing of those wounds. And if there's any possible drainage. Did you have any wounds on your body?
I don't.
Today. Good, that's good. We would assess in an older patient. Heidi is very active and mobile, but in an older patient we would assess for pressure ulcer potential, which is when there's too much pressure applied to bony prominence, and if there's skin breakdown it can cause big problems. So we would do some education about that and just assess for any areas of pressure ulcers. In palpating her skin, I would be sure to check all areas of her skin, including her feet especially in an older person, and checking for edema around her ankles and all the way to her toes. Your toes are cold.
Yeah, not bad.
They're not. Capillary refill is one of the points that we would be looking at now, which would indicate oxygen circulation, and it should be 3 seconds or less, and she has good capillary return there. And of course, as you're assessing, you're checking on both sides of the body, bilateral for all of these points, both feet, her toes, and assessing that. Her hair and scalp, she has beautiful hair, cute little haircut. And just feeling, kind of palpating all around to make sure that there's no abnormal bulges or anything like that. She has good hair, her scalp looks very healthy, and just an overall appearance of her skin, scalp, and general appearance. That's right. Moving right along, now that we've basically done an overall appearance of Heidi's skin and her general appearance, we're going to move into musculoskeletal system. And in this area, we're basically checking for pain and cramps, any spasms that she may have on any specific muscles. I'm going to check, if you'll raise up, best to do this in a standing position. We're going to check her spinal alignment, whether there's any curvature or concaveness of her spine. And again, I would have her standing up to assess that correctly, but just to let you know that we would be checking that. Okay, you may go ahead and lay back down. I'm going to be checking her range of motion, and there are several exercises that you can do to check range of motion. Motion is basically just moving the joints, the different muscle areas and the joints on the legs as well as the arms, and she has good range of motion. Of course, this whole time we're assessing and asking the patient if she has any concerns in any areas of range of motion. Do you have any concerns?
None.
None at all. You're very active and working out, and good for you. Okay. Let's see. As far as musculoskeletal, in checking her musculoskeletal system, we're also going to check the hand grasp and make sure that the bilateral hand grasps are the same and good. She has good, strong grasps, as well as all the way down her body to her feet flexion. And if you'll just press against my hand, very good. And we'll feel here too. Very good. She has really no muscle atrophy going on right now. She's a young, healthy girl, and so she's doing fine in the musculoskeletal system area. Okay, moving along to the central nervous system, there's lots of areas that you can assess with that. Primarily the patient's level of consciousness and mental ability. Part of that would be orientation, which includes time, location, and person. And so you would ask the patient questions like, do you know your name?
I do.
What would that be?
Heidi.
And do you know where you are today?
Yes.
Where is that?
I'm at our school.
Oh, good. Okay, we're pretending that you're in the hospital, though.
Okay.
You're not very mentally sane, are you? No. So you would just assess the level of consciousness. You can use a mini mental exam, which is a series of questions that indicate cognitive ability. And we know that healthy Heidi doesn't have an issue with that. But just asking questions, especially with a person that may be a little disoriented, an older person for dementia, that kind of thing. You may ask the patient if they're comfortable, if there's any areas of pain that they're experiencing, and if so, where is it, and the duration and the time in relation to the pain specifically. At this time, sorry, don't knock her in the head. I would be assessing Heidi's pupils for reactivity to light, and that they're both equally the same, reactive to light. You have very beautiful eyes.
Thank you.
So you would use your pen light and check reactivity, and that the pupils are equal. At this point, I would also assess Heidi's hearing and tell you I'm going to turn away from you so that you can't read my lips, and I'm going to whisper, and I want you to tell me if you hear it.
Okay. I really didn't.
Are you deaf?
No.
So if there is a problem with hearing, you may use your handy dandy little
Tuning fork.
tuning fork.
Yeah, I can hear that.
Me too. It's like an instrument. We could be in the bell.
Other way.
So we have lots of tools and equipment that we can use to help determine if there is a hearing loss. With something like this, the tone vibrates. And there are different ways to use this appliance, with placing it behind the neck on the bone, or behind the ear, excuse me, on the bony area. And if the patient does not hear with the vibration on the area, it can indicate conductivity hearing loss. So there are just different ways that you can determine the degree of hearing loss, and that would be part of the assessment in the central nervous system area. Okay, do you have any history of seizures or tremors
Nope.
with yourself?
I don't.
Okay, and how about your skin as far as the occurrence of tingling or any burning sensations like that?
There isn't any.
No.
Mm-mm.
Okay, so you're over along to our cardiovascular assessment. At this point, we would take a blood pressure assessment. It would be good to take a blood pressure reading on both sides of her body to get an equal, to determine if it's bilateral. And I'm not going to go into the blood pressure reading, but I would take it on her left at 110. I already passed that in lab, so I'm not doing it right now. We know we can do that. Okay, the blood pressure would be determined, the quality, whether or not she has any orthostatic or posterior hypertension. Do you feel dizzy when you stand up?
Nope.
Or any of that? Okay. The pulse rate would be determined. My watch. How your pulses?
Mhm.
Palpitating. Okay. And again, both sides. A normal range would be 60 to 100, with right in the area of 80 being a norm. You can also at this time palpate for a pedal pulse. And again, according to Heidi Johnson, who's a wonderful instructor, you will never lead off the feet. We will always palpate the feet and check the feet in all patients of our practice. Okay, so I will palpate your pedal pulse as well on both extremities. In checking the cardiovascular system, you can check for any distension in the jugular veins, neck veins, just the body temperature overall. We can take your temperature at this time as well. Good. Okay. Part of the cardiovascular assessment would include auscultating for heart sounds. And so I'm going to demonstrate that now. And you're primarily listening for the S1 and S2, which would be the lub-dub, lub-dub, lub-dub. And you have a very healthy heart, I can tell. You would be listening for murmurs, any defibs, dysrhythmias at that time, you could auscultate for that. Basically that. Stop.
Okay.
As part of the mucous membranes in your mouth, using a tongue depressor, checking for stomatitis and just making sure that mouth is healthy and there's good circulation in there. Part of a cardiovascular system assessment would also include back to the skin and the pallor and the turgor and all the things that are involved with oxygen circulating through your body. Okay, so which leads us to the respiratory system assessment. We would be checking for general appearance and adequacy of respirations and having the patient breathe, take deep breaths while auscultating the lungs. So I'll have you sit out, sit up, sit out, and auscultating all 4 lobes of the lungs, all the regions, beginning and just, of course, you can't talk while you're doing it. You have to listen. You're listening to the quality, depth, whether there's any crackling or wheezing, taking the respiratory rate of the patient during this time, where a normal value would be from 12 to 20, typically around 18, as far as respirations go. And we're inspecting for the size of the thoracic cavity, the bilateral contour, making sure it's equal on both sides, the shape, and the presence of any spinal deformities as well. Palpating and checking the area of the trachea, make sure that it's aligned correctly, whether there's any subacute emphysema, and respiratory excursions. And Heidi, again, looks very healthy. With an older patient or a patient maybe that would have chronic COPD or something like that, this area of assessment would be very important. Back again to respirations and the respiratory system, we would be inspecting as well the mucous membranes and the skin, the color, which indicates perfusion of oxygen. So as these assessments are, a lot of them overlap, so some of the things that you assess for would apply to many different areas of systems. The best position for the patient as far as comfort in breathing, lack of pain. Again, Heidi is very healthy, but a patient that is not may have a difficult time sitting up like this, so if it's more comfortable for them to be in a semi-Fowler position during the assessment, that would be best for effective respiration. I would ask my patient if she smokes.
No.
Good for you. And if the patient does smoke, you would determine how many packs of cigarettes they smoke a day and for how long. Smoking is a very hazardous thing to do for your health, and so that would be definitely incorporated into the assessment. And lastly, again, I would review the chart and your patient's history for any drugs related or labs that would pertain to the respiratory system. Next would be the GI system, the gastrointestinal system, inspecting for the abdomen, again, contour, size, color of the skin, and any venous patterns. I would actually look at her skin. And just kind of an overall general appearance. At this point, you would auscultate for bowel sounds, again, doing all 4 areas, and starting with the lower right quadrant, listening for about 30 seconds, hopefully hearing some bowel sounds, and then moving up and around the small intestine and transverse. And if there was one region that you didn't hear bowel sounds, at that point you could go back and reassess that area, listening anywhere from 1 to 5 minutes until you do hear bowel sounds. You would assess your patient for nausea and vomiting.
I have none.
None, good for you. If the person is experiencing nausea and vomiting, you would determine how much, how often, and what the appearance of the emesis is, okay? I would also at this time assess Heidi's diet, the type of diet she eats, how much, how often she eats, what kinds of foods, just to determine and include it as part of your chart, okay? Have you experienced any changes in your appetite or taste buds or taste sensations lately? Nope. No? Okay. How about your ability to swallow? Any issues
Fine.
with that? Okay. Any recent changes in your weight, either up or down?
Nope.
Nope. Okay. You've stayed pretty consistent. You've
Pretty
had
much.
these genes for a few years. So
3 years.
3 years. Good for you.
Yeah.
How about your bowel movements? Are you pretty regular?
Yep.
Yep. Okay. Don't really want to talk about it?
Nope. They're fine.
Everything fine. Moving along fine. Some patients do have issues with bowel movements, which could correlate back to their diet, and you can do some patient teaching at this time. Also, if you have any issues with bladis, which is your gas passing, only when you eat beans, correct? You would inspect for ileostomy or colostomy, and if they do have that, you don't have that anyway?
I don't.
Okay. You would check the appliance and the function of the appliance, the appearance of the skin and the area around the appliance, and just to assess whether it's working out for the patient and the adequacy of the equipment. And then lastly, in this area, the GI area, we've assessed everything going in, what goes in, the system that it takes, and then coming out. So I would check your chart for any drugs that relate to the GI issues and any diagnostic tests that you have that would correlate information.
Okay.
Moving on to the urinary system. In assessing that, we would determine what the usual pattern of urinary output is. Do you go to the bathroom fairly often and on a regular basis?
Yep.
And the appearance of your urine and the color, the consistency, any odor
Nope.
issues. If there were issues of odor and sediments, it could indicate a urinary tract infection. Do you have any complaints of feeling of urgency, or that you can't go, or that you can't hold it? Okay. At this point, with Heidi's age, or even women that are a little bit older that have had babies, I would encourage Kegel exercises, which would help with bladder muscle control, and you can do a lot of teaching during this part of the assessment. At this time, you could palpate the bladder for any distension, and really determine most of it from a interview type process, because she knows more about what's happening with her body and her urinary system and what's normal for her. A lot of this in assessment area would be asking questions to determine if everything's working the way it's supposed to. Again, review the chart for any past histories, and if there were urinary issues where you felt like you were having a urinary tract infection, there are diagnostic tests and cultures that could determine to what degree you would have an infection. Okay? As far as the reproductive system, I would assess Heidi's menstrual cycle and what her normal cycle rotation is as far as days and length of time, whether you've had any children or not.
No.
No babies? Are you going to have babies?
Later.
Later in life. Okay. You can determine if there's any pain or tenderness, cramping. Also, of course, assessing the breast. Doing a yearly exam is most appropriate, and encourage the patient to do monthly exams. Are you comfortable with doing monthly exams, and do you complete
Yep.
monthly exams? Okay. It's best to do those right after your period is over, not prior to, because sometimes there's hormonal things going on that if you're going to do a monthly exam, it's best to do it after your period has passed. Okay. You can palpate, like I said, the breast area. We're not going to do that today, but on breast exams. And then again, assess if there's any problems during your menstrual cycle. None?
No,
Yes?
none.
Okay, good. And then, of course, I would do some patient education with Heidi in the area of STDs and that kind of thing as it relates to her age and her time in life. Okay? And again, which leads to the fact if you're asking questions about vaginal or penile discharge, which could indicate a yeast infection or even up as far as an STD. So we would go into all those questions as it pertained to my patient. If it was an older patient, a 90-year-old woman that I was doing an assessment on, I would more focus on other areas of her assessment, such as cardio and respiratory, instead of sexual and reproductive issues. So you would address your assessment to fit your patient's needs. And then, if there's any drugs, are you taking birth control?
Yep.
Good. What form of birth control do you use?
Pill.
The pill, okay.
Mm-hmm.
At this time, again, if the patient said no, would be a good time, especially if she was sexually active, you could discuss some of the options with her and even give her some referrals to obtain specific information, yeah, okay? And then lastly, I would end my assessment with a psychosocial portion. And this would just give me an opportunity to ask Heidi how she's feeling in regards to her emotional state. Are you having any areas of anxiety or stress?
School.
School is stressful.
Yeah.
Yes, it is. What kind of coping skills do you have with you? Do you have a support system around you, or
Just my friend.
just your friends? Okay. And do you take some leisure time?
Yeah.
In between too. Very good. And so I would use this time in my assessment to maybe elaborate on Heidi's coping skills, and if she feels that she is too stressed out, and what happens to her if she did indicate that she had severe anxiety or mood depression states, manic depression. Do you have any kind of
No.
symptoms that would, no, okay, you're able to cope with.
Yeah.
It would be in this part of the assessment, though, that you would determine that and then take the assessment a little further if she did indicate that there were areas of depression or anxiety, mood problems that she was having. Okay. We are getting close to the end of your assessment. I would then give my patient an opportunity to share anything that she feels she would like to discuss. If this is just a basic physical assessment where she's coming for a basic checkup for sports or school or what have you, just to get something signed off, and really doesn't have any health issues, we would elaborate more in the areas that she has concern. At this time, I would give my patient an opportunity to ask me any questions or share something that she may be specifically experiencing and wanted to have checked out or assessed. Would you have anything like
I
that?
have none.
None like that, okay. Well, I'm thankful that you're a very healthy patient. I'm thankful for you. And of course, you would document all of your assessment findings in their chart. Documentation would include all the information from the physical assessment, any variations in normal conditions, and of course, any lab or diagnostic tests that we did in relationship to your physical assessment. The points of documentation would include objective, subjective, any nursing diagnosis that relate to the assessment, and then the plans and goals to alleviate any problems. Okay, so very good. It's been a pleasure to
Thank you.
assess you today, and I hope you have a great day.
You too.
Okay, see ya.
Hi, I'm Renaye Wheaton, and I am going to do a general assessment today on Heidi. I don't know why I laughed, I just do. So, don't laugh. Hi, my name is Renaye Wheaton, and I am a nursing student on my way to be an RN. And I am going to do a full physical assessment today on my good friend dear Heidi, who has volunteered. And we're going to start out with the integumentary system, and I'm going to assess the skin and the mucous membranes. I'm going to look for turgor, which you can just pinch right up here, and she's got great turgor. So general appearance, we're looking for any bruises, lesions, any kind of, we're looking for color. We want to make sure that it's not cyanotic, that's not jaundice, it doesn't have pallor or redness. The temperature, we're going to make sure that it's not too hot or not too cold, which could mean a lot of different things. We're looking for any venous patterns that are abnormal, any bleeding or lesions, bruises, infection of any of those areas. And if she does have any wounds, we're going to look for healing to make sure that they are healing properly, or if there is drainage, and then we'd assess that drainage. And for a patient that's not doesn't have very good mobility or is older, we're going to look for assess for the presence of pressure sores or the risks for pressure sores. And then we're going to palpate her skin. We're going to look for any pain, if she has any edema in the feet, and look for those kind of things. Any altered temperatures. We're going to look at her nails, make sure that they're normal, concave, they're not clubbing. We can do the capillary refill. Should be less than or 3 seconds or less. The hair and scalp, we'll make sure that there's no bumps, bruises, lumps, any dryness, excessive or non-excessive growth where she's balding. That would be abnormal. The next thing we're going to go into is the musculoskeletal. We're going to look for limb movement in regard to range of motion, strength, equality, make sure that both sides are the same. We can do grip exercises where she can squeeze my fingers and make sure that it's the same on both sides. Resistance exercises where she can push against me. We can do that with the feet, where she would press, or she could press this way, and we would do that on both sides. Look for muscle pain, spasms, cramps, and we would be asking the patient if she knows of any things like this, if she's had any past experiences with it. We look for the joints, make sure they're not stiff, ask the patient if she's had any stiffness in her joints or pain, if they're abnormal looking or anything like that. We'll look at the bones for normalness, contour, and prominences. Abnormal findings may indicate trauma or degenerative joint disease, musculoskeletal disease, or neurological problems. We'll assess her ability to sit, stand, walk, her posture and gait. Those are all things we can assess as she's walking into the room, as she sits down on the bed. All these things we can kind of be watching as we're assessing the whole thing. We look at her spinal curves, and a way we can do that is to have her bend over, make sure the shoulders are the same, looking for kyphosis or lordosis. And abnormal things would be like atrophy, where the muscle is actually decreasing, tremors, or flaccidity, which is weakness. And we would have also done a lot of the range of motion exercises, making sure that it's full range. Now we're going to assess the level of consciousness, the CNS. We'll ask Heidi if she knows where she is.
I'm in Rapid City, South Dakota.
And who are you?
Heidi Pamsa.
And what year is it?
2006.
And she obviously knows where she is. Another way to check the mental status is to do a mini mental exam, which is a series of questions. We're not going to go into that today. It's a longer process. We can assess for comfort, presence of pain, anything like that, just kind of what we talked about earlier. If there is pain, we want to know the location, the duration, the type, and the treatment for the pain that she's on, any meds or anything like that. Sensory functions, we're going to look at her pupils, and we're going to make sure that, there we go, that's how it works. We're going to make sure that they dilate equally. And they do, they look really good. And they are reactive to light, so that is a good quality. We can do hearing by whispering. I can turn away and whisper something and see if she hears that. We do that on both sides. And or I could use the tuning fork, and that is another way to assess her hearing. We would assess the skin for any tingling, numbness, or burning sensations. And as I said earlier, along with the CNS, we'll do muscle, motor function, hand grip, foot strength, plantar flexion, movement posture, things like that. And those are things, again, we can assess as the patient walks into the room. Now we'll move on to the cardiovascular system. We're going to assess Heidi's pulse. I can just palpate right here, and I can watch for 30 seconds, looking for regularity, rhythm, quality, the rate, and she is good. So we are going to move on to blood pressure. Like Diana said earlier, we have learned how to do blood pressure, but we would do it on both sides in normal cases, but we do know that Heidi is healthy. Healthy Heidi.
Healthy Heidi.
So we're not going to go into that, but we would check both sides, looking for a normal blood pressure. Also, we would assess for postural or orthostatic hypotension, which can mean several different things. And we would assess the neck veins for any distension, which hers are normal. So that's something we would look for. And the body temperature, which goes along with cardiovascular system and the oxygen and all that stuff. It'll change. And now I'm going to listen to heart sounds. There's several places that you can listen to heart sounds. The apical pulse, which is the midclavicular line, fifth intercostal space. Listen to different valves, but we'll just listen right here. And I can hear her heart, and we're listening for S1 and S2, the lub dub, and that is present. And I do not hear any murmurs extra heart sounds, dysrhythmias, anything like that, which is something you'd want to listen for and look for. We also want to assess her mucous membranes, make sure that there's no angioedema, stomatitis, which is inflammation of like the tongue and the mouth, and we'll just have her look here, look in the throat, look for redness, any discolorations, anything like that, which could indicate a lot of different things. And again, the skin for cyanosis, pallor, flushing, any of those things that have to do with the cardiovascular system. So that would be next. Like I said, I was looking for, when we were looking at the integumentary system, we were assessing for edema, pitting edema, non-pitting edema, and we'll look for those again in the feet. The nail beds for clubbing, these all have to do with the cardiovascular system, the capillary refill, palpate peripheral pulses, like the pedal pulse is very important. You should always check the pedal pulse. Can tell you about a lot of different things. Any evidence of bleeding, non-bleed, or nosebleeds, incisions, and bruising or hematomas. I need to look for. There we go. Now we are going to go into the respiratory system. I'm going to assess the general appearance and adequacy of her respirations, and she has been breathing normal this entire time. Not too fast, not too slow. Assess the rate and the rhythm and the quality of the respirations. 12 to 20 breaths per minute is the norm. And is she using any of her accessory muscles to breathe? The size of her thorax, shape of thorax, and presence of any spinal deformation, which we would also be looking at when she's bending over or we have her sit up in bed. And then we're going to palpate the position of the trachea. It should be aligned. If it's not, it could mean a collapsed lung, which is not a good thing. The presence of subcutaneous emphysema, which actually sounds like Rice Krispies under the skin, and any respiratory excursions. So, with that said, we will also listen to the chest, auscultate for inhalation and exhalation. You're going to listen all the way down to the front and the back. You want to check all the lobes, bilateral symmetry, if that's the right word. Audibility, I want to be able to hear it, the quality of it, the depth of it, type of breath sounds, any crackles, anything like that, presence of adventitia, wheezes, things like that. If the patient is coughing, I need to know the frequency of the cough, duration, whether it's productive or not. Sputum. If the sputum is present, I need to assess the color, consistency, and amount, and assess for complaints that the patient has had just recently or currently, shortness of breath, dyspnea, orthopnea, which is shortness of breath while lying down. I would want to make sure to listen all the way down the back on both sides. I'd inspect the mucous membranes again and skin for color, which indicates perfusion of O2. And I would determine the best position for the patient for comfort and the best breathing positions, which is usually the Fowler's position. At this time, I'd ask if the patient smokes, and if she does smoke, how many packs per day and how long has she been smoking. And then I can review the chart for any kinds of drugs or things that she is taking or labs that she's had dealing with the respiratory system. So, moving on, we're going to head down to the GI system, and we're going to inspect the appearance of the abdomen, the size, contour, the color of the skin, which I won't pull up her shirt and look at, any venous patterns. If it's distended, I want it to check and see if it's round, tender, hard. I'm going to auscultate for bowel sounds in all 4 quadrants, starting in the lower right for 30 seconds, and then I'll move up and around. And then if I don't hear anything, I can stay there longer, up to 1 to 5 minutes, to make sure that there are bowel sounds present. Palpate to determine if it's soft, tender, hard, if there are any masses or ascites. Ask the patient if she has any nausea or vomiting.
None.
None. And if she does have those things, how often and how much, and the appearance of it, things like that. And then her diet, the type, the amount she eats daily and how often she eats, any dietary restrictions or intolerances, and any changes in appetite or taste, ability to swallow.
No changes.
No. And assess for recent changes in weight, either increased weight or decreased weight.
No.
Okay. And then assess the usual pattern of bowel movements and passage of flatus, which is gas. And that's been going away okay, I hear. So, and then if she has an ileostomy or colostomy, we would definitely want to make sure that the function of the appliance is working and doing its job, the condition of the stoma and the skin, and the adequacy of the equipment. And then finally, review the chart and assess drugs and any diagnostic tests or labs that affect the GI tract. Now we're going to move on to the urinary system. We would assess the usual pattern of urinary output with regard to amount, the color, the clarity, sediment. We would assess for complaints of frequency or urgency, necessitation, dysuria, hematuria, number of times, any UTIs that you've had. Have you had any problems that you know of?
No.
Nope? Okay. And we palpate the bladder for distension, anything like that, pain. And then if the patient does have a urostomy, other methods of apical urinary drainage, check those, make sure that the stoma is all right, adequacy of the equipment again. And review the chart and make sure that she's not taking any drugs, or review the drugs that she's taking or any tests that deal with the urinary system that I would need to know about. The reproductive system, we would assess for sexual maturity, determine if the patient has any pain or tenderness, changes in breast appearance or lumps. This is a good time to educate your patient about breast exams, giving herself monthly breast exams and then getting a yearly one. And we would assess the breast for symmetry, size, shape, contour, skin, condition and color, the nipple, condition, and position. And that's all stuff that we will not do today. We'll let Heidi do that while she's at home.
Gotcha.
And the other areas of the respiratory system, or the reproductive system, we would check for. The psychosocial. At this time, I would want to ask Heidi if she has any concerns about her health issues or being hospitalized, any anxiety or mood changes or depression. I would kind of look for and see if I see anything or notice anything on my own. And adequacy of support systems, find out who her support systems are, and if you have a support system, do you have a support system?
I have friends.
Good, that's good. And alterations in lifestyles related to health status, any history of abuse, physical, sexual or emotional, and her coping strategies for those things. Also, if you use drugs or alcohol abusively, and I don't think you do that. And learning needs regarding health concerns. So I would just help her to understand any things that she is experiencing and help her learn how to deal with those. And finally, I would want to make sure to document the information obtained during the physical assessment and interview with the patient, all subjective, objective, nursing diagnoses and assessments, and record specific goals and plans, and related problems found, including any referrals. So with that said, that's just a brief overview. So